Good. Well, we have a huge crowd today. Yes, absolutely. Absolutely. And this is being recorded, right? Okay, perfect. So yeah, I'm Bailey. I'm with Cigna. I am here to talk to you today about how to be a better overall healthcare consumer. In terms of what this will review, we're going to be reviewing how to take control of your health, understand and maximize your health plan, and manage your health costs. There's so much in today's world that's coming at us in terms of what's online and what can help us find the best costs for certain procedures and whatnot. I want to be able to show you what Cigna has to offer to help maybe mitigate that a little bit as well. So we'll just jump in here by talking about what it looked like when I just recently purchased my kitchen table. Thinking that you guys really care about what my purchase journey was like. But I needed to set my criteria. I wanted it to be round. I wanted it to fit, the space. I wanted it to have a leaf, and so it would extend into an oval. I wanted it to be gray and solid wood. So maybe my list was too particular or specific, but I researched online and in stores. I read reviews, compared prices, and then I eventually made my purchase. I want you to think about something that you have, really thought about before making a purchase. Maybe it wasn't a kitchen table. It could have been something that was a piece of clothing. It could have been a home or a vehicle or whatnot. Just want you to think about that for a minute. And then ask yourself, what type of consumer are you? For me, I'm more of the researcher type of consumer. You'll see that at the very bottom. But there are all different types of consumerism, and maybe you don't even fall onto this spectrum. But there's the discount consumer, which is somebody who's looking for discounts, essentially, that will only purchase items if they're on sale or at a discounted price. Or you have an impulsive buyer, somebody, it sounds just like what it is. They don't look at the price. They know that that's what they want, and they go ahead and slide the card or write the check or whatnot. Then there's needs-based. These are people who really need the item, not necessarily want it. Somebody who has a hole in their tennis shoes, and then they go and purchase a new pair. And the researcher, as I just mentioned, that's much like what I just shared, a lot of reading reviews, cost comparison, and so on. There's mobile shopping and online shopping today, which I'm sure we're all familiar with. And it's gained so much traction that places like Toys R Us are going out of business. And I know the mall near my house in Salt Lake, a lot of the stores in the mall are going out of business due to that as well. And then there's loyal customers. These are individuals who are loyal to the brand, loyal to the company, regardless of the price. Those that are loyal drive about 55% of the revenue for companies. Anybody want to share what type of consumer they are? Does anybody know? Go ahead.
I'm a mobile shopper.
You're a mobile shopper. Yes. Especially with kids, it's probably nice and convenient. Yes. Anybody else? What's that? You're a mixture. Yeah. And that's
Depends on the day or the item.
or the item. Yes, yes. And I'm glad that you brought that up, because you don't necessarily have to fit into one category, like you said. It varies upon what different items you may be purchasing. All right, so now considering what type of day-to-day consumer you are, what type of healthcare consumer are you? When you are needing a procedure, are you out there shopping the different prices? Are you looking to see if your healthcare provider is in network? Are you looking to see if they're a preferred provider? All of these things we will address. Do you do that research? What will it take for you to treat healthcare benefits and healthcare costs like other items? And it might not be as exciting as other items. Like, going to get your lab work is a lot less exciting to me than buying a kitchen table, and it doesn't seem like I'd want to spend some research or time in looking into that lab work. But the realization here is that you can save so much money if you just take a little bit of time and do some research. So what healthcare consumerism is and why it matters. So in the blue box, you'll see that healthcare consumerism's goal is to enable patients to become fully involved in their healthcare decisions. So today we are in a world of, in the world of health insurance, it's just continuing to increase year after year, and it's very hard to stay on top of. And so we want to be able to help provide these tools and resources so you can, again, be a better consumer, so you can make these informed and educated decisions, because it not only impacts you individually, but it impacts your fellow employees in terms of your insurance rates and how their health is. It also affects a national level in terms of our health. We not only want you to be, more present at work and reduce absenteeism, and that's all part of this as well. Again, we want to help you help save your pocketbook. So let's talk about some examples of what healthcare consumerism might look like for you individually, and how you can maybe incorporate this into your life, or how you already are. So health insurance is one thing that we're talking about today. Understanding your plan better, understanding some of the terminology, what in-network means, out-of-network means, understanding your deductibles, and we'll talk about all of that. Understanding the tools and resources that your carrier has to offer, like a cost estimator tool that I'll share with you. Also, wearable devices. As you know, there's a lot of different devices out there, Fitbits, Garmin's, Apple Watches, and so on. These help you be a little bit more accountable with your health in terms of tracking your sleep, your stress levels, physical activity, and so on. We know that when we are overall healthy, our obviously medical costs are lower, and we prevent illness, which we'll talk about too. Health-driven technology. So that's just a lot of apps and websites that are out there. So there are, for example, pharmaceutical apps that are called, there's one called GoodRx or Needy Meds, or there's different tools out there that are showing you how to locate urgent cares. Cigna has a lot of those resources already that fall under the Cigna umbrella, but those health-driven technology pieces are out there. Wellness programs. So you know that you have a wellness program here. At least I hope you know that. And so we're just going to pause for a minute and talk about your health program. So I know you have a lot more than just Motivate Me, but that's what I'm going to highlight today is Motivate Me. That's the first flyer that's in this packet. Many of you have maybe seen this already. I was here several months ago reviewing this when it was first rolled out. Motivate Me is Cigna's internal kind of platform to help provide and incentivize individuals for their health behaviors. And so if you open this up onto the first page, you will see that it gives you step-by-step instructions on how to log in and how to get started with Motivate Me. So everybody needs a mycigna.com account. You simply need to register. Step number 2 is that you need to click on your health plan. Step number 3 is incentive and awards is where you go. You'll see where it says take some time to explore. It says that the program period is January through December. So keep in mind that that's how long you have. That's your deadline is December 31st to get all of this done and receive your rewards and incentives, which your reward is and incentives are $125 that you can obtain by completing a few items, which we'll review here in a moment. Essentially, how those rewards look is you will go after you complete an initiative, then you will be able to go in and cash out that dollar amount for a gift card. There's gift cards, hundreds and hundreds of them. So I know you'll be able to find one that will be applicable to you. On the next page, where it says take some time to explore, explore the content or understanding your health risks. These are the different initiatives that you need to complete. So you'll see that you can either complete your annual physical or your OBGYN exam, both of those which are at $50. Following that, with the little apple, it says get a personalized health assessment. That is the health assessment that you do online, and that's $25 there. Followed by that, with the image of the woman kind of exercising, I participated in a wellness activity. Can you remind me what your wellness activity was? Okay, it was the sleep challenge. So if you completed that, you just need to go in and check the box that you completed it, and you will receive that incentive. And then the last item is that you can pick one of the 11 coaching opportunities, those are the remainder boxes, to participate in. On the very last page there, you will see that this is how you redeem your gift cards, or kind of cash out those dollar amounts there. Any questions about Motivate Me? Okay, I'll be here afterward too and would be happy to answer any questions or pull anything up on the computer that you might need assistance with. Take control of your health. How can we take control of our health? Well, we can maintain a healthy lifestyle. That's where it always starts. It really does start with us. At least 80% of all heart disease, stroke, and type 2 diabetes, and up to 40% of cancer could be prevented. Those are some pretty staggering numbers, right? I'll say it one more time. At least 80% of all heart disease, stroke, and type 2 diabetes, and up to 40% of cancer could be prevented. It could be prevented if we live a little bit more of a healthy lifestyle. If we do some of these things where it says it all starts with you, if we exercise a little bit more regularly, eat nutritiously, add a little bit more sleep into our lives, reduce alcohol intake, quit tobacco, and adhere to medications, all of these things have a domino effect. And it looks overwhelming when you look at that list. I completely understand that. And that list is even longer. Those are just a few, right? So let's just take eating nutritiously for an example. That doesn't mean eat 100% organic and cut out all sugars and anything like that. It means just be more conscientious, be more intuitive. Maybe reduce one less drink a day. Maybe it's eating out one less time a week. Perhaps it's adding one more fruit or vegetable into your daily diet. And then you can continue to build upon that. So that's a good thing to focus on, is maintaining a healthy lifestyle. One of the key factors into maintaining a healthy lifestyle is starting with your preventive care. So it's important to first and foremost have a primary care physician, which I'm going to show you how to locate one on the Cigna website here momentarily. Some good questions to ask yourself are, am I up to date on my immunizations? Do I have a primary care doctor? Am I eligible for specific age and gender screenings like mammograms, colonoscopies, cervical cancer, and there's a bunch of other ones as well. And what about biometric screenings? Do I know my numbers? Do I know what my blood pressure is, my glucose, my BMI? And I know that you guys have those available to you, and you have done biometric screenings the last several years. So that's great to be able to participate in. The reason why we really encourage individuals to go and get their annual physical is because when you're working with a doctor, they can diagnose. So let's take, for example, here at your biometric screening, that the nurse that was testing you maybe said your blood pressure, you wanted it to see in this range, and it was in this range. That's all they can tell you, is that maybe it was just not in the accurate range. Whereas if you go to your doctor, they're going to ask more detailed questions. What's your lifestyle, hereditary type of questions, and so on. And so from there, then the doctor can begin to help you, onto some corrections to help you with your overall health so it doesn't get more serious. Also, something to know about your annual physicals or well visits are that they are covered at 100% annually. So there is the next flyer in your packet is this preventive healthcare packet. This is everything that is covered at 100% for you, dependents, spouse. It's color coded. So pink represents female, blue represents male, and then the green is the dependents. So this is something that I would recommend to take advantage of. It will give you the specific ages and so on. Any questions about preventive care or preventive health? I know, it's all very exciting. Understand and maximize your health plan. So your current health plan that you're on, how can you understand it a little bit better? And how can you maximize it to benefit you? So we're going to go through just a little bit of learn your lingo that I think most of you might be familiar with, and I will definitely jump in to help as well. But if you wouldn't mind participating, can somebody share what a deductible is? Or know what a deductible is? Anybody? Yeah, it's the dollar amount that you pay before the co-insurance kicks in. So the co-insurance is an 80-20 split, which means that once you hit that deductible, then Cigna will pay 80% from there on forward, and you are responsible for 20% until you get to what is called your out-of-pocket maximum, which we'll review that as well in a moment. What about a copayment? Anybody? Yep. So the county offers two different health insurance plans. They offer one that has a copayment, and then the other plan is a high deductible HSA plan. So the difference between those is that the copayment you pay when you go to the doctor or to a specialist. The other high deductible health plan is essentially you pay out of pocket for everything that you do related to health care. So that is what a copayment is. What about a consumer-driven health plan? I kind of just reviewed that. That goes hand in hand with a high deductible health plan. Again, what we're talking about today, why it's important to make those informed decisions when it comes to your health care, because every dollar is initially coming out of your pocket until you hit that deductible. In-network, anybody want to share what that means? Yep, perfect, yeah. So it's a contracted in-network provider or facility, and it's knowing what is contracted. Again, we have those resources that I'll show you here in a moment. Sometimes it can be very, very confusing. Sometimes you might go to a doctor that is covered when you're at the hospital. For example, this happens a lot of the times with OBs. They will see you in their office, and that is covered there, but they deliver at a different hospital that's out of network or not contracted. Balance billing. Anybody familiar with this or know what this means? Balance billing is when you go out of network. So if you don't use a physician that is in network, you go out of network, and Cigna will still oftentimes cover some of that out of network. However, there will be a large remaining balance, and that's what you would be responsible for. So we always want to try and stay in network because the amount of money that you can be responsible for if you go out of network is astronomical. Out-of-pocket maximum. Anybody know what this is by chance? Yes, who's familiar with meeting that out-of-pocket maximum? It's not very fun all the time. Yeah, lots of hands. So out-of-pocket maximum means that it's the maximum dollar amount that you will pay in a given plan year. So let's take a premature baby, for example. The reason why I give this example is because a lot of premature babies are easily what we call million-dollar babies in the healthcare world. And so if your out-of-pocket maximum was $10,000, that's the most that you're going to pay, even though it was the overall cost was really $1 million. Coinsurance, I briefly highlighted this. This is after you hit the deductible, then that 80/20 kicks in there. A health savings account. Is anybody familiar with a health savings account? Yep, HSA. So this goes along with and always ties into a consumer health-driven plan or a high deductible health plan. This is a little card that is exactly like a debit card. It's great because it's pre-tax money. It rolls over year after year. You can use it as like a savings account towards retirement and so on. And then out of network, which we've already highlighted there. Something else to know and how you can maximize your health plan is through some resources that Cigna has to offer. So we have gym discounts. If you're not familiar, that's the next flyer that's in your packet. It will review some of these things and show you how to find these available to you on My Cigna. It includes coaching programs, so much like the ones that you're doing in your Motivate Me program. Also, there's weight loss programs, employee assistance programs. So there's assistance with vision, like LASIK and hearing aids and things along those lines. It's essentially anything that the medical plan does not cover. We try to help provide some discounted rates and relief there. Manage your costs. This is the fun one. So we've already highlighted in-network. Try to use, if you're looking at Cigna's website, I'll show you how to know if a provider is in-network, but we always want you to call and double check. Our system does take 24 to 48 hours to update, and I have had it before where a doctor was in that transitional phase. So please just call, and what you will ask them is use the correct verbiage such as contracted or in-network. So if you call and all you need to say is, are you contracted or are you in-network with Cigna? Also, different ways that you can see if a doctor is in-network or a facility or anything like that, again, is through My Cigna, which I will show you, and you can always call that 24/7, 365 number on the back of your ID card. All right, so nowhere to go. This is one that we continually see that a lot of members struggle with, is understanding and knowing where they should go when it comes to their health care. So let me just review a few places that you can go to. Telehealth is the first, kind of the first resource. It has the least amount of waiting time and the least amount of money associated with it. Has anybody ever used telehealth? No? Okay. I will give an example. So I've used it for strep throat when I knew I've had strep throat. My husband's used it for when he knew he had a sinus infection. My coworker knew that he had pink eye that he got from his little kid. And they can prescribe medications over the phone. Not any narcotics, anything like that, but different antibiotics and so on. So that's what this next flyer here is showing, know before you go. And the ones right behind that are reviewing telehealth. So this one here shares a lot of different things that you might use telehealth for. And it's open 24/7, 365. You can use it for dependents as well. It's great because what happens when you go to the doctor for a doctor's appointment when somebody's sick? You might catch something else while you're there, right? And you can do it from your home. You can do it as a phone call or even like a FaceTime. So I know somebody else, like they've had a rash and they've used telehealth. You just FaceTime and show them the rash. It seems a little bit weird, right? But this is definitely the way of healthcare and the way that it's going. So for those of you that are on the co-payment plan, that pay $35 when you go in to see your primary care doctor, that is how much it will cost you for telehealth. Okay? If you're on the high deductible health plan, you'll be paying $42 to utilize telehealth. We offer two different services. Or two different companies, I should say, that we contract with, and that's the additional two flyers. So we have MD Live, and the next one is Amwell. Both of them are essentially the exact same service. I've used both of them, and the only difference is MD Live can help assist with Spanish needs. And since we insure people all over the country, some of these are only allowed in certain states. Here in Utah, you have access to both, so it doesn't matter which one you use. You'll see this is how you download the app. The one thing that I'll say, if you can see the little emblem or logo right there, it will say MD Live, and then in fine print it will say For Cigna. You'll just want to make sure that those are the ones that you download, Amwell, For Cigna. It's also just a little recommendation and something that I've learned from experience. The last thing you want to do when you're sick and not feeling well is need to register for something. It's just not convenient. It's not a convenient time. So I'd encourage you to maybe after this meeting or sometime this week, try and just download that. Then when you need it, you know that it's there. Any questions about telehealth? Very good. So convenience care clinics. This is something else. Has anybody ever heard of a convenience care clinic? This is also, you can see on this spectrum here, less time, less money. I did look in your general area of your zip code here in Brigham City, and they are not very convenient here. The closest one is in Ogden. It's great if you're planning to head that direction, and maybe you can swing by there on your way back or make an appointment. The idea is that this can help save money in terms of just general health care, flu shots, any type of immunizations, if you have a cold or flu-like symptoms. Following convenience care is the doctor's office, urgent care, and then the ER. So we know that the ER, we really only want to go to the ER if it's a life or limb type of situation. Other than that, you have the urgent care and these other resources. So let's talk about maybe where we could go for specific conditions. You will also have this little sheet that was in your handout, and it lists all those things that we just talked about, telehealth, convenience care, and so on, so you can use this as well to kind of guide this. But where do you think you could go for a rash or allergic reaction? And by allergic reaction, I'm not saying like anaphylactic shock, because that would definitely be ER, but mainly a rash. Telehealth. Where else? Convenience care clinic. Yep. Convenience care or doctor's office, or go to the ER if it's a life or limb situation. And then you always would want to start with telehealth and maybe work your way, depending on the specifics. One thing that you can do is you can call that number on the back of your ID card and ask to speak to a nurse. They're there 24/7, 365 as well, and you can ask them where they would recommend that you seek care. So I think if you have time to call the nurse, it's not necessarily a thing that you might need to go to the ER for, but they can help say, yeah, use telehealth or go to the urgent care, and then they can even help find facilities for you if needed. So stick with lower cost labs. Labs meaning for your blood work, for a urine test, anything along those lines. Cigna contracts with two of the largest national vendors, LabCorp and Quest, that you can see listed there. If you choose to go to a LabCorp or Quest, you can save up to 75%. Yes, we do contract with other providers as well, but you will get the biggest bang for your buck if you use one of those two vendors. You can see what the average Quest or LabCorp cost is at about $10, what the average other lab costs, and what it looks like at a hospital. So you might wonder, well, how do I know if I'm at the doctor and they draw my blood, or I'm at the hospital and they provide a lab? How do I know where they're sending it? You can ask. You can say, where is this being sent? And oftentimes a LabCorp request is in the hospital, but also oftentimes it's literally across the street or it's around the corner. So you can ask the doctor for a prescription and tell them that you want to go and get it at an off-site lab. That happens all the time, especially if you're on that consumer-driven health plan. This is a great way to help save some money, and I'll show you how to do that as well in a moment. You also, the next flyer in your packet is reviewing labs and shows you some of the cost savings. Consider in-network freestanding outpatient surgery centers. You guys ever heard of these before? So instead of going to the hospital for a colonoscopy or an endoscopy, there are freestanding clinics that are out there, and this is something to look into as well. You can see how big the cost savings can be if you were to go to one of these freestanding clinics. Again, much like the labs, they're usually across the street, around the corner from the hospital facility. And consider independent radiology centers. So if you're needing like an MRI or a CAT scan, again, they're kind of freestanding facilities, just like the colonoscopy example that was just provided. You can see that the average radiology center is $500 for a CAT scan and about $800 for an MRI. If you were to go to the hospital, you can see that cost difference there. Pretty big cost savings. All right, so who has used MyCigna before? Is anybody an expert in MyCigna? Not an expert. I guess a lot of us have used it, and I'm just gonna show you here how to utilize some things. So we're gonna switch gears. And in order to participate and motivate me as well, you need to have a mycigna.com account. All right. So I'm just going to log in here. It's just mycigna.com. Oh, maybe it's not going to work.
So if you use MD Live or Amwell, it's $42 if we're on HSA. Either one.
Yep, either one. We'll see if this wants to work. It was working a minute ago. Okay, perfect. So here we are on, oh, it's perfect for me, not perfect for you quite yet. Wait for that to,
You want to take it out and put it back in.
okay. Sorry, it's just taking a second here. All right, here we are on my Cigna. So this is what it looks like when you originally log in. And you can go right here. This is the main tab that shows you the cost estimator tools and whatnot. These tabs are really where you'll spend most of your time reviewing your coverage. You can look at your plans. You can look at your explanation of benefits.
Can you zoom in a little bit?
Yes. How's that?
That's right.
Good. So reviewing my coverage will review your benefit plans, how close you are to hitting your deductible or your out-of-pocket maximum, what all of your benefits are and what's accessible to you. Managing claims and balances, this will show your different claims. You can filter it by your spouse or dependents and whatnot. Look at your different explanation of benefits as well. This is how you will find different providers and costs, and I would say this is the tab where I feel like most people spend their time. So right here, you're going to change the address or zip code. So we'll just use your zip code here. Whoops. And this will populate. Now in this little search bar, this is where you can search any procedure that might be happening. If you're looking for a family doctor or primary care physician, if you scroll down, there's also popular searches here listed on this side. So you can see that a primary care provider, we'll just click on that instead of typing it in there. We'll see what this populates here. So you can see that there's 182 in-network doctors. Again, in-network is what we're looking for. We know that they're in-network if they have the green check mark. Something else that I'm going to show you is this Cigna Care Designation, or this C. You can filter for different specialties, quality, care, and recognition. So I'm going to filter by the Cigna Care Designation. I always do that, and you'll see that the number of in-network doctors just changed from 182 to 49. What the Cigna Care Designation means is that we review doctors to see what their statistics as to how their employees are feeling after they come and visit them. So if it's a surgery, for example, we will do a review with that individual and see if they were ever readmitted back into the hospital. What was it for? Was it for an infection? Just evaluating the overall care. So these are your doctors that have the Cigna Care Designation that are top performing, just so you're aware of that. Okay. Something else that I'll show you here as well is an example of a procedure. So let's just say it's a gallbladder surgery, and you can see there's all of these different items that it populates. So if you're looking for a gallbladder surgeon, but we'll look for the gallbladder removal surgery. And so you can do it for a spouse, a dependent. We'll just leave it as the guest or subscriber. But if you scroll down here, you can see the cost differences. So it's saying you may owe this dollar amount, but it's ranging anywhere from $6,000 to $8,000 depending on the doctor and the facility. So you can do this with any type of procedure, colonoscopy or whatnot. All right. Any questions about that? Does that seem pretty simple and straightforward to use? Again, I would say that if you do see an estimate for a procedure or something like that, keep in mind it's an estimate. And you can call Cigna or you can call the doctor as well to have them give you more specifics. All right, gotta find the clicker here. You know what? I'm actually going to show you something else so I don't have to switch screens again, and show you what you can do in terms of medications, and I'll review that in a little bit more detail here back on the presentation. But this is how you can look at the medication costs, the pharmacy costs. You'll click on this home delivery pharmacy tab, and you can click down here to say get drug costs. All right, so we're gonna search another location here, and we'll just put in your zip code again. All right, so I'm going to show you a prescription. This is called Synthroid. This is a prescription that's used for hypothyroidism, for any sort of thyroid condition, even some thyroid cancers. Get a cost estimate. All right, so you will see here that here are the different pharmacies that are in network. The ones with the green check marks mean that they are in network. You'll also see that it says 90-day network pharmacy. That means that you can go to that pharmacy and get a 90-day fill on your maintenance medications. So like Synthroid would be a maintenance medication for your thyroid, maybe a medication for blood pressure, diabetes, things like that can be 90-day fills. Whoops. If you scroll down here though, you will see that Synthroid is the brand name here, and you would pay $94. There's also a generic equivalent, and you can see that you would just pay $28. So this system will help you understand what the generic alternative may be for you as well. Now this is for Cigna Home Delivery Pharmacy or for Kent's Pharmacy. Cigna Home Delivery Pharmacy is great. You can call and get that set up. You can ask your physician to help you with that as well, for a 90-day supply again for those maintenance medications. One other thing that I'll show you in terms of looking at a different medication. This is a drug called Lyrica, and this is for a lot of different things as well: diabetes, shingles, epilepsy. Let's search your location. All right, so it populates that as again, and right below you can see there's only brand that's available. There's no generic that is available for this drug. So you can see how quickly you can hit the out-of-pocket maximum with expensive drugs like this. So something to keep in mind there. Any questions before I leave my Cigna? No? Okay. Let's go ahead and just bring this back up. Okay, perfect. So this is essentially just showing mycigna.com what we just did, and this is talking about prescriptions. So some things that you can do to help potentially mitigate that cost for prescriptions is just be that better consumer. Go on to mycigna.com, talk to your physician about that. There's other apps that are out here that I'll explain to you is independent drug coupon apps. Is the drug covered by Cigna? If so, how much will it cost? As I just discussed, try and get mail order or 90-day bills. They're usually discounted as well. The second item there is drug couponing forfeits the ability to track towards your high deductible health plan. So if you do use a coupon for that needy meds and you're on the high deductible plan, it will not apply towards your deductible. If you were on the